Hi everyone, my name is Sabrina and I am the Community Outreach and Development Manager at the Inova Medical Spa in Ashburn. And today is like a birthday to me, but not. It's a Botox Dysport birthday. So today is going to be my very first time getting Dysport, which is a neuromodulator that many people kind of know as Botox. Botox is a form of it. But for 3 years now that I've been leading the spa, I have not done Botox or Dysport, and today I'm just biting the bullet, taking the plunge, and there's no one else that I would trust more than Danielle to do it.
Thank you, Sabrina.
I will tell her, take the time to turn the time over to her so that she can tell you a little bit about her and why I trust her so much.
All right, so hello everyone. Thank you for joining in. So I am Danielle. I'm a certified physician assistant. I have about 11 years of experience in cosmetic dermatology and plastic surgery, and injectables are my passion. I love the skincare field and everything within cosmetic dermatology. So with Sabrina today, because it's her first time, we're certainly going to do a thorough consultation, go over what her concerns are or what my recommendations are, risks associated with the procedure, and what to expect. So what I'd first like to start off by doing is let's take a look in the mirror, and you can tell me a little bit about what's concerning you.
So I'm getting to that point now where, I'm starting to see some lines in my forehead when I raise my eyes, and when I smile, I'm noticing a few small lines. And then I'm a huge Instagram social media person, and I've seen that you are able to kind of enhance your lip line with neuromodulators, and I'm not really sure if that's something that you can do, but I would say those are my few big areas of concern.
Okay, perfect. So let's take a look at the anatomy of Sabrina. And what I tell patients is every individual, every face is a little bit different. The anatomy is different. So what you may see on Instagram or social media, when you come in, it may be a little bit different for you in terms of units or recommendations. So let's go through, we'll come up with a treatment plan for her, and then we'll do the injection. All right, Sabrina, so if you can take a look in the mirror for me. And what I'd like to do is have you raise your eyebrows up real strong. Okay, so this muscle up here, over time, with us being expressive, we're having that expressive animation. Mm-hmm. Every time we raise our eyebrows up, it creates these creases that are beginning on you. Mm-hmm. So at this point for you, it's more prevention, which is actually very good because we want to catch this before the lines get a little too deep, and then we would have to incorporate other services. So this is a great time for Sabrina to get started. Okay, so now I'll have you squint down between your brows. Okay, so these muscles are strong in here. You're not at the point where you're necessarily getting creases. Mm-hmm. However, what we want to do is still inject this area so that it looks uniform and it looks appropriate when we inject the upper forehead. Smile real big for me. Okay. So again, here it's prevention for her. It's just going to open up the eye and prevent crow's feet from developing. What I'd also like to do is do a little bit of a brow lift right here, and what that will do is just open up the eye slightly. I don't want to do too much of a brow lift for her because she already has great natural arching on her brows, so it's just a subtle opening. Now, what we always want to look at as well is every face has asymmetry. So for Sabrina, her brows are a little bit asymmetrical, so what I want to do is just compensate for the one brow being a little bit higher than the other. Now, what we can also do is something called a lip flip. So for patients who maybe have the start of what we call smoker's lines, even though they may not be a smoker, we start to get little etches into the upper lip. It's little vertical creases that start. So what we want to do is relax down the muscle that causes that creasing. Sabrina, can I have you purse for me? Okay. So for her, the muscle creasing is not real significant, but for a lot of patients, over time, as we age, that muscle starts to pucker the skin, and then we develop those fine lines. For Sabrina, what we want to do is more flip the lip up a little bit and make her a little bit more symmetrical. So by injecting the Dysport into the upper lip, It's just going to evert or turn out the lip very subtly here. Okay. Questions on that so far?
So no, but I know that there's some questions that have been circling through my mind, and there's been so many conversations that we have had. I think it's important for, other, I would say, like millennials and people who are interested in neuromodulators to know. So like for me, the toxicity of certain things, and like, is this safe?
Sure.
I like eat organic, like Whole Foods is my favorite, place to shop. I'm really conscious of what I put into my body.
Mm-hmm.
And so I guess that has been something that has sort of made me a little bit more hesitant.
Mm-hmm.
And then the other question that I have is, am I gonna look frozen?
Sure.
Like, I want to still look natural,
Mm-hmm.
and kind of what's your philosophy on those two things?
Those are great questions, and I actually have those come up quite often. So my philosophy on the injectables is to definitely have a conservative approach where we can add more later. So once the Dysport kicks in, usually by the second week, I do have the patients come back. We can always do a little bit of a touch-up in case she needs more. But again, the goal is to keep you looking natural, where no one should necessarily pick up that you've had it done. It should just be more of a natural rested look, where someone maybe says, did you have your hair done? Or did you change your makeup? But it shouldn't be pinpointed that you've had Botox or you've had filler.
Right.
Regarding, Botox and Dysport as being toxins. So they are made from botulism. The dosing is very, very minute, where in comparison to other procedures, for medical purposes, they do use much higher dosing with Botox and Dysport. So I certainly want you to feel comfortable. This is a very light dose. This has been, used in services for 30, 40 years or so, and patients do really well with it. In the 11 years I've been doing these injections, I've never seen any sort of complications from the procedure.
Great, thank you.
You're welcome.
Yeah.
Are you excited?
I am.
Okay, first time, newbie. So what we're gonna start off by doing is I'm gonna have you relax right on back. I'm gonna clean the skin, and I'll walk you through it as we go along. All right, so
I know, can you believe this is happening? I'm like,
3 years in the
yes,
making.
I know.
All right, so here is our Dysport. So whatever procedure that you are having done, you should always see this sitting on the counter. You should never have a provider walk out of the room and then come back in with the needle where you're uncertain of what you're getting. So always ask what it is that you're getting. But again, this should always be sitting on the counter. This is essentially what it looks like when it comes in. And you can see here, what I end up doing is mixing a little bit of solution into this vial to make it a liquid, where then I can inject it. So we already have our vial set up and ready to go. And I'm gonna draw everything up. So when we talk about dosing for Botox or Dysport, it's based on units. How many units are being injected into an area? So everyone's a little bit different. For instance, men versus women, generally men take a little bit more units, but we'll go through that as well. Sabrina, do you have any questions?
I am good. I'm anxiously awaiting.
Okay, so
results.
what I'm gonna do first is just clean the skin. All right, so we're gonna clean the skin real well here. And I will let Sabrina know before I do any sort of injecting, so she's not surprised.
Danielle, do I have to avoid any specific activities, or is there anything that's contraindicated? Can I go back to work? Do I have to stay out of the sun?
Good question. So a lot of my patients actually come in the morning before work. They come in their lunch break. So it's not that this is going to look like you've had something done. If anything, you have a little redness around the injection site. For 24 hours, avoid exercise. Avoid alcohol until this evening. Avoid massaging the areas today, meaning you can still put makeup on, moisturizer, but just avoid pushing in the areas, because we don't want the Dysport to spread to a different muscle.
Got you.
And that's basically it. You want to allow 2 weeks for this to work. You should start noticing improvement around day 3, day 4, when it starts kicking in. And what I mean by improvement is that when you go to raise your eyebrows up, and if you can do that for me, By about 2 weeks, we're gonna notice this muscle softens. Same with between the brows. When you go to squint down, you'll notice by week 2 that that will be relaxed, and the same with around the eyes. When you go to smile, that muscle will start to soften out real nicely. All right, are you ready?
Yes, let's do it.
Okay, so what I'm gonna do now, all right, so I am drawing up our units, and to convey the idea of a unit, think of it as a droplet. So for Sabrina, for instance, we are doing 20 units to do a little bit of a brow lift or an eye opener. So we're gonna start with the injection, and I'm gonna walk her through it so she feels comfortable. And I've already cleaned the skin really well. All right, Sabrina, so what we're gonna do first is the brow lift portion. And again, that's just gonna open you up slightly. So here comes a little pinch. Good. How we doing?
Good. I can't even feel it. It's like
Another pinch. Okay, so that's the brow lift.
barely anything.
Okay, and next is crow's feet.
It's just so funny because I've seen so many and like assisted, you know, in filming videos for your Instagram, and
Now you're the
I'm
patient.
the patient. Yes.
All right, so next is crow's feet. So if I can have you smile real big, and what I'm looking for is the muscle movement, and now I'll have you relax. Okay, little pinch here. Okay, pretty easy. Good, okay, and now we'll do right side, and I'll have you smile real big for me and relax. Okay. Okay, next we're gonna go in between the brows. All right, Sabrina, if I can have you squint down real strong, perfect, and relax. Pinch. And then squint down again and relax. And so what you see me doing here is actually isolating the muscle. So when she squints down, I actually grab the muscle and hold it. That prevents disbursement of the product into a different muscle. Okay, and squint down again real strong and relax. Pinch. Another one here. Good.
Yeah, I mean, I don't even feel those little pinches.
Okay, and then lastly is a little bit on the upper forehead. And I'm actually going to raise the bed up a little bit here. Okay. If I could have you raise your eyebrows up very strong for me so I can see that muscle and relax. Okay, pinch here. Another pinch. And what you'll also notice is that when the lines soften, your makeup will actually sit really smoothly. Because a lot of times when patients, you know, you wear the makeup and the creases are developing, the makeup can actually sit into those creases. Okay, a couple more and then you are done.
Awesome.
Okay, that portion is done. Now we'll move into the upper lip.
We did it.
Okay.
Upper face, we did it. Uh-oh. The lips, though.
Last one is the lip. So we'll do 4 injections
Okay.
across the upper lip. What I always like to tell patients, it's more so with your first injection. When this starts kicking in, typically around day 3, day 4, what will happen is you're going to notice a little bit of an awkward sensation. What I mean by awkward is that if you were to drink out of a straw when you're brushing your teeth, you're just going to be conscious of the product working on that muscle where it's a little bit weaker. Okay, so just may feel a little awkward around day 3, day 4. If you're drinking out of a water bottle or drinking out of a straw, you'll notice that, but it's not anything concerning where patients say that they never will do it again.
Got you.
Okay, so when you're ready, I'll have you purse and relax. Pinch. Okay. Another pinch. And again, what I'm doing is compensating for the little bit of asymmetry that she has across the lip. Okay, and then purse again for me and relax. Good, last one. Okay, that is it. So pretty quick, about 10-15 minutes. Welcome to the club.
Woo!
Give it 2 weeks to work and you'll start noticing that nice improvement.
Yay!
Typically, patients come back about 3 to 4 months.
And what about for the lip? Is it the same?
Typically, with the lip injection, you're coming back maybe every 8 weeks.
Okay.
Because you still need that muscle movement there. Whereas on the forehead, around the eyes, we can weaken that muscle a little bit more. All right, and that is it. Again, avoid massaging the areas. Give it 2 weeks to work, and we'll get you set up for a follow-up to come back in and see me in 2 weeks.
Thank you, Danielle.
You are
So
welcome.
excited.